But I want to thank you all for attending. I am Emily Weiler with the Montana Public Health Training Center. I'm here today with Lee Taggart, who is actually our Workforce Program Director here, and the awesome Celine Beamer, which I've had the joy of working nearby, at least for many, many years now. So they're going to go through the very fantastic, amazing assessment that they did. And I say that because I was involved in the one from 2020, and it's a big lift and an impressive amount of data. And so very excited for them to present today on the results of that and how they built that massive survey. We're recording, so for anyone that can't attend or has to leave early, we will have that recording available later. If you get booted, just click on that Zoom link, I'll let you back in. And I'll keep an eye on the chat. So if you have questions for our presenters, I'll make sure they don't get missed. And I'll mute you. So with that, I'll turn it over to Lee and Celine, and you guys can get us going.
Great. Thanks, Emily. Hi, everyone. Welcome. And my name is Lee Taggart. I am the Workforce Program Manager at the Montana Public Health Training Center. I'm also a adjunct faculty and teach a couple of the courses in the School of Public Health. And I'll let Celine introduce herself.
Great. Thanks, Lee. So my name is Celine Beamer Shepard. I am research faculty at the University of Montana in the School of Pharmacy and a recent graduate in December 2022 of the dual degree program with the Master's in Public Administration and a Master's in Public Health.
Great, Celine. And I do want to acknowledge that we are practicing and working on the lands of the traditional lands of the Indigenous people, and we are greatly grateful for that. So before we get started, we would love it if you all would put in the chat your name, your job title, and your organization. And that just gives us a sense of where you're coming from. And we are excited to get started. There's definitely some new faces here. And did we have a poll question here, Celine? I don't think we did.
Didn't, no.
Okay.
We were just going to give everybody a chance to do some,
Great.
verbal, if we had a small group, or written introductions to see where everyone was coming from and what their background is. And then just talk about what we're doing here today, which is, as Emily mentioned, to discuss these awesome findings. So the one thing I left off of my introduction was that I'm involved in this project because this was my capstone work with Lee for my Master's in Public Health. So I interned with her from August to December, and my project was building out this survey. So I'm really excited to tell you about that work because it took a long time to put together. And our training today should take about 2 hours. We're going to make sure everybody gets a break in the middle of that for about 10 minutes to go to the bathroom, get some more coffee, move around, because we do know it's a fairly long one. And then we're hoping that you are all here because you guys play a huge part in ensuring that our communities continue to enjoy that high quality public health services. And in order to do that, we need a really robust and sustainable public health workforce. So we're excited for you guys to see the data that we've collected and think about some of those gaps and opportunities and ways that we can continue to provide awesome services and improve the workforce.
Yes, absolutely. And I will say that this project would have been a lot more challenging had Celine not been a heavy lifter in the creation and the dissemination of it. And we'll get to that. So speaking of, the agenda is here. Like Celine said, we're going to have an overview. I'll talk a little bit about that. Celine will talk about the methodology and the dissemination. And then we'll start into the results, beginning with the demographics and the workforce composition. That'll bring us right up to about probably around 10 of 11. We'll take a nice stretch break, get some coffee, and then we'll come back and dive into some of the more granular results of the core competencies, the professional development and training, some key findings, and then reviewing some strengths and areas of opportunities. So, one of the things we're hoping as we're going through these results is that you all brainstorm a little bit about what are some opportunities or what are some strategies that you and your organization are using to address some of these issues. And we hope you share some of those with us, including challenges, because we know that workforce development is a hugely challenging problem and to tackle. And finally, we'll wrap it up with some question and answers. So I think for the sake of time, if you have a question as we're going through, just go ahead and put it in the chat. And what we'll do is, if it's a specific question to that one piece, we can address that at the end of each section. But if it's a more broad question, we'll get to that at the end of the presentation. So yeah, I'm going to get started on the overview of the workforce assessment. So like Emily said, this assessment there was an assessment was done in 2019, 2020. And I'm wondering if anybody can just show of hands if people have seen that report, the 2020 workforce. Okay, Nicole, yes. I can't see everybody. You can use your emojis on your, if your camera's off, just go ahead and you can put it in as a raise your hand or a thumbs up. So this project was a reevaluation of that workforce assessment and so I feel really lucky we had a wonderful framework to follow. Here is our first polling question. So if all of you can just put in, the first question is, how familiar are you with the 2020 statewide workforce assessment? Either very familiar, somewhat familiar, not very familiar, and have not heard of it. The second one, okay, so question 2, how familiar are you with the 2022 statewide workforce assessment? And then number 3, did you fill out the 2022 workforce assessment? So looks like the majority of folks did not fill it out, which is, it's really great that you all are here, because I think we will be sharing some of the information that we found, so this will be all fresh for you. So the goal of the workforce assessment is to collect comprehensive information about the capacity of the public health workforce across the state of Montana. And I will say that this assessment included state employees and local and tribal employees. It did not include nonprofits, out-of-state public health workers, or any other folks that are working in public health, but not for a local, tribal, or state health department. We figured that there are somewhere around 1,000 employees statewide that fall under that category. But to be honest, the state doesn't actually have a specific number of how many, we don't know exactly how many there are. But really what this assessment does is it allows us to gather data on the workforce, identify the strengths and potential gaps in that knowledge and skills. And that is done through the core competencies, which we'll talk about after the break. And then really important is to establish priority trainings that address those gaps. So a lot of the questions in the survey had to do with motivation to attend trainings, how you like to attend trainings, and then a self-assessment that allowed you to rate your knowledge confidence in the areas of the 8 domains. And again, I'll get to that more later. But really, it's a report that can be used for funding, training, recruitment, retention of our public health workforce. So we had some guiding documents that we used. Definitely the 2020-2021 Public Health Workforce Assessment and Plan, which is what we talked about, I asked about earlier, that Emily was a big part of, and that document was a guiding document for us. The other emerging document that has been had lots of national representation and coverage is the PHWINS, and this is a de Beaumont Foundation funded framework, and they also have a wonderful website with tons of information and data about the workforce nationally. And just before we disseminated our assessment, PHWINS had done a large national assessment, and Montana did participate. A small percentage of Montana workforce folks participated in that. And so our questions fit very closely with some of the questions that were on that PHWINS survey. Some other documents that we included were that we referenced the core competencies for public health professionals, the 10 essentials of public health 3.0, the foundational services, what we call the strategic skills and alignment, which is done by the National Consortium for Public Health Workforce. That's also a de Beaumont Foundation initiative. And then, of course, accreditation, the FAB and CEF, which is our accreditation for the School of Public Health. So we tried to use documents and frameworks that are recognized nationally, and that provided us with a strong foundation and a strong ability to make our data more robust, and so that the uses of these results could be used in a variety of ways. We couldn't have done this without our Workforce Advisory Council. This is a group of public health professionals and leaders from these different organizations. Interestingly, this group has been meeting since about 2017 in different iterations. And they all come with a lens that provided us and gave us great guidance. They were with us from the very beginning all the way until currently. Again, we couldn't have done any of this work without their guidance and their assistance. And I will also add, we had some representation from the Rocky Mountain Public Health Training Center as well, which is our affiliate, our mother training center that we are under, and their guidance was very, very helpful as well. So we thank all those people. And I can't see when people are raising their hands, so just shout out if you have questions or anything, because my screen won't let me see everybody. So in summary, this assessment, again, was a repeat from 2019-2020. It's allowing us to look at trends in our public health workforce. And I think one of the things that we can't deny is that COVID rocked our world, and to be able to have the data from before COVID to now is very, very interesting and very helpful. We are still working through some of that data, so we're not going to be presenting on some of those comparisons, but moving in the future, that is something that has an opportunity. And again, what we're hoping to present to you today is identifying the strengths of our workforce, as well as exploring areas of opportunity that allow us to help grow our public health system. And we also are really focused on this collaboration and not duplicating efforts of what other organizations are doing out there. I think that's one of the goals of this group, of our group, and of this work, is that we're understanding the landscape of what's happening out there in terms of whether it's assessments or training opportunities, to ensure that we're providing our workforce with the trainings they need, the skills they need to flourish, to be able to do the work that we need to do to address those 10 essentials of public health and those foundational services. So with that, I'm going to pass it over to Celine, and she's going to talk about the methodology and the dissemination. And like I said, unless anybody has a specific question about the workforce assessment overview, we'll move on to the methodology and dissemination.
Perfect. Thanks, Lee. So I'm going to launch, I think, our second little poll / quiz here. And it's got 3 questions again. The first one is, have you previously designed a survey or an assessment on any topic? The second is, are you familiar with any of the survey tools listed? And it's got some of the basics: Qualtrics, SurveyMonkey, Jotform, and Zoho. And then, which tools and platforms does your organization have access to for surveys? So we'll just give everybody a second here to answer all of those questions. As Lee mentioned, my capstone project was putting this thing together, so I get to tell you what we did and how this was all built. I'm not going to go into a lot of the details on actually question design and the thought process that goes into choosing the types of questions that are answered. It's going to be a little bit broader picture of that, because I think we might do an additional training in the future of survey design and question building and platforms and things. Looks like we've got about half of the group has answered. So,
And for that,
Cheryl.
and the number 3, the things that folks wrote in were SurveyMonkey.
Okay,
What-
everybody answered SurveyMonkey as far as a platform they have access to.
Yep.
Okay. Well, it looks like about half of you have previously designed a survey. And as Emily mentioned, everybody is really familiar with SurveyMonkey, not so much with Qualtrics or Jotform or Zoho is a free tool. But that's a great piece of information for the next training that we do on question design and how to actually build these out, is to know what everybody's got access to. So thanks. All right, let me close the poll, and then Lee, since you're driving, there you go, perfect. Next slide, please. That's fabulous. So this really is a summary of designing the workforce assessment. As Lee mentioned, we had our Workforce Advisory Council that met monthly. I started the timeline in June because this is kind of about when things were really getting rolling with this workforce assessment. So a good questionnaire or survey assessment, whatever you want to think of these as, should be valid, reliable, clear, and interesting. It's important to think of and design the questionnaire based on a conceptual framework, which Lee just went over. So that's really the purpose and the objectives of your survey. You don't want to bombard your employees or the public with a lot of questions that really don't make sense. Just because you can ask a question doesn't mean that it needs to fit within your survey. And you really need to look at each question for relevance and clarity. And for us, part of that process was having a lot of our Workforce Advisory Council look at the questions, think about whether they really met the need. And then lastly, the analysis side. So think of the analysis you're going to perform at the end of the day and how are you going to use it. So going back to our timeline, the Advisory Council has met monthly since I've been involved. As Lee mentioned, our guiding documents were identified, and I built out the first draft of the questionnaire. It took about a month of going back and forth and tweaking the questions and really trying to get down to the meat of what we wanted to know in this workforce assessment. We went down a couple of rabbit holes looking at wellness and burnt out, and then decided that that had been covered in a lot of COVID and post-COVID studies, and that we really didn't need to do that. So by the end of September, we had a final draft approved, and this was all initially started in Microsoft Word, just to make it easy to share that document back and forth amongst the group. And then afterwards, I started building this out in Qualtrics. So that was the platform that the University of Montana has access to. It is a fairly expensive platform, but it can do a lot of different things for you. We did beta test this. It took me about 2 weeks to build it. And then we had about another 2 to 2.5 weeks of beta testing amongst our advisory council and users to see, did the questions flow? Were the answers coming in? For example, on questions where you say, choose your top 3, did it limit people to 3 or was it open-ended? There's lots of tweaks that go into that. And by the end of November, we had our final version built out following that feedback of our beta testing, and we were able to launch that on November 9th. I'll go into a little bit more of the details about the dissemination efforts in a subsequent slide. But as Lee mentioned, our target participation was about 500 individuals. We were hoping to capture half of the public health workforce across the state. So we left the assessment open until the end of December, and that was partially related to timing, and it seemed as though our responses were fizzling out, but also so that I could wrap up a little bit of my assessment to close out my capstone project for my master's in public health. And then since then, January to date has really been the data analysis, working on the written report, and then this spring and summer is the assessment piece from the side of planning for workforce trainings, really looking at what the responses told us and how we can address. The workforce assessment was built into chunks. The initial one, section 1 that we called it, was our demographics. So there's some pretty basic 5 questions of age, let's see, gender, a few other areas. And then we got into the core competencies. This section had 19 questions, and it was pretty meaty. This is the in-depth self-assessment of public health knowledge. We then had a section on the workforce characteristics that got into a lot more details about individuals' education, their training level, where they were in their career path. Are they new? Are they supervisors or executives? And then the last section, section 4, was the workforce training needs assessment, which was another 17 questions. So this is really the second step in building our successful and engaged or productive public health workforce. Is we really have to know who's here and what do they know. And the reason for that is that gathering and analyzing that people data is going to determine how the workforce contributes to the future of public health in Montana. This survey took about 25 to 30 minutes to complete. Something that I really thought was an interesting and unique feature of Qualtrics was the ability to download a copy of your responses. And the thought behind this was that individuals could potentially share that information with their supervisor or mentor, not only in terms of performance review, but to potentially guide their continuing education. At the end, we did have an entry into a prize drawing, and this was built into a separate survey so that an individual's name and contact information was not linked with the survey. So the workforce assessment was in no way linked to any one person. It was de-identified. So in order to get this out to our 500 target, we relied pretty heavily on the Workforce Advisory Council. So we asked them through emails and various meetings that they were on to, please push this. We had a task force meeting as well where we were doing this. We targeted our DPHHS and Confluence colleagues to reach leadership, to have supervisors and mentors push the survey. We did email health departments with the link. We looked at our alumni listserv from the School of Public and Community Health Sciences, used Connected Community as well as newsletters to get this out. So it was quite a big push in order to achieve that target number. We really advertised it through no rock left unturned, basically. The assessment, as I mentioned, was sent to all 56 health departments, 8 tribal health departments, as well as PHHS. It was emailed, links were sent out. Only complete responses were analyzed. So we used the Qualtrics platform, left the survey open for about 6.5, 7 weeks. We had a total of 513 respondents. Interestingly enough, 65 were incomplete for a variety of reasons. We had a typographical error initially that somehow even after our many eyes of beta testing was missed. So we had to eliminate responses to that one question. Only one participant declined, got into the survey and then said, no, I don't want to do this. So our final number that we were able to analyze was 448, which was just a little bit higher than the previous iteration of the survey. So we felt pretty good about being able to get close to our number. Strategic workforce development and planning is really, I feel like, one of the most powerful tools that public health can use to achieve our goal, right, for all of us, which is to improve the health of people and communities. The third step, if you want to think of this as a stepwise process that we're going to talk about today in building this successful and engaged and productive workforce, is to develop and implement an action plan based on the skills gaps and needs identified. So we were, as I mentioned, we were really excited that our target participation was reached. So we had about 500 responses to look at. And then we're going to talk to you about the information that comes out of our question formats. So one of the key pieces that I wanted you to take home from this was that the question design, the content, the wording, the length, the order, the format might have impacted some of our data points, but they're lessons learned for the next time around. And those are hopefully some lessons if we do a follow-up training on question design and how to put surveys together that we can share with you at that point. We just don't quite have time for it today to go into that. And with that, I'm going to switch it back to Lee for the next section, going into some of the nitty-gritty details of what we found.
Great. Thanks, Celine. Yeah, so we're going to get now into the results of the survey. And I will reiterate what Celine mentioned about the lessons learned when putting one of these surveys together and putting it out there. There's always a question of what order do you put things in? Because one thing we did notice, those 65 people that dropped off right after the demographics. And right after the demographics came the core competencies. And I think those are probably some of the harder concepts for folks to understand. So in hindsight, we might have put some of the more of the characteristics ahead of the core competencies to see if we could have gathered a little bit more information from those 65 folks before they glazed over at the core competencies. So in terms of our results, we felt really positive about the number of the variety of the different health departments that we got results from. So of our respondents, of our 448 that we analyzed, 120 or 30% came from DPHHS, 126 or 31% came from large health departments. And then we had a pretty nice mix of frontier, small, and medium representation. We recognize that we had a very small turnout from tribal. I will say that they had just done their own workforce assessment that came out in October of 2022. So I think we probably lost a lot of folks due to that because they had just filled out their own assessment and that report had just come out. So, but in the future, we would love to work harder to engage that population in this assessment. The other positive, I will say, with the demographics and with this question is that in the 2019-2020 assessment, it was not clear if you worked in Helena, if you should answer for DPHHS or Lewis and Clark. So they unfortunately had a lot of crossover there. And so that information wasn't super clear. The way we set up our question this year was excellent because they basically, once you answered DPHHS, you couldn't answer anything else. So it clearly delineated DPHHS from the rest, from the local health department, Lewis and Clark. One thing we could have done a little better is that we still allowed people to answer 2 ways. So some folks did answer some of the answers were duplicated in this answer, in this question. But overall, I think we had a nice representation from across the state, and really from, if you look at the map of Montana, we covered a lot of territory across the state, which was great. So in terms of the our demographics, we have, unsurprisingly, 86% of our workforce are female. About 12% are male, and less than 1% identified as non-binary. What I'd say is that the strengths for this is that we know we meet closely with national data on this. Women predominantly are represented in public health, but I think we have some areas for opportunity to attract more men and more of our LGBTQ population into public health, and especially as we really want to start addressing health equity and having a broader vision on our where our populations are heading, we need to make sure that our workforce represents that population as well. When it came to age, we have about 14% of our population are over 60. 19% are between 50 and 59. So that leaves about 60. So what we recognize is that about 66% of our of the workforce is under the age of 50. Under the age of 50, which is, in my mind, a very positive discovery, because though if well supported and provided opportunities for professional growth, we have a good, strong workforce that can take us for the next 10 to 20 years. So this is an area that we really want to make sure that we're addressing the needs of our population, that our workforce that's going to stay in public health for the next 10 to 20 years. The other interesting fact is that 43% of our population, of our workforce, is under the age of 40. So it's a fairly young workforce. And that, again, is an area of opportunity to ensure that those folks are being mentored, that they're being supported as they enter their career in public health. And we'll talk more about that later in the discussion. When it came to ethnicity, not surprisingly, our workforce clearly mimics the Montana landscape, so mostly white or Caucasian, and mostly non-Hispanic ethnicity. We asked questions about employment status. So do you work full-time, part-time? Do you work temporary, permanent? Again, unsurprisingly, 89% of our workforce works full-time, 10% works part-time, and about only 1% works either what we call casual, per diem, as needed, which that I feel like this is an area maybe of opportunity, because we know that I come from the world of nursing, and we know that we use nurses a lot in surge situations, whether they're considered a per diem or a casual. And I think we do have room to expand that area to help people fill gaps, rather than feeling like they have to be committed to a full-time job or a part-time job. The other is in the area of contract work or temporary work. So if you look at the results on the right with permanent temporary, 80% of our workforce is permanent. Only 3% were temporary. So again, here's an opportunity to utilize whether it's a contract work, whether it's a short-term work, to fill those surges when they happen. I will also add that as we were going through the results, we did have folks had the opportunity to answer, prefer not to answer, or prefer not to respond. So that number is included in all of our graphs here. It ranges anywhere from about 10 to 15% that folks just chose not to answer that question. So that's the 14% on the right pie that chose not to respond to that question. When it came to the composition, so we asked, how many years have you been in public health? How many years have you been in your current organization? And how many years have you been in your current position? And these were some really interesting results that, again, give us a chance to look for areas of strength and areas of opportunity. So when it came to the years in public health, we have 44% of our workforce that have been in public health for more than 5 years. This is a really great percentage of people that can act as mentors, that can help with succession planning. They've been through a pandemic now, and they can be role models for our new workforce that's entering, who have been in public health even less than two years. And one of the interesting pieces that Celine did for part of her capstone project was she pulled out the data on all of the folks that were new, what we call our newbies. And those were the folks that had actually been in their current position for less than 2 years, as you can see on the graph from on the right-hand side. And it's a lot of folks, right? We know there was a lot of turnover in COVID. And if you look at that right side, the 61% of the respondents had been in their position for less than 5 years. So again, this just reinforces how important it's going to be moving forward, that we have strategies and methods in place to ensure these people feel well supported, that they're getting the knowledge and the skills that they need to do their jobs well. And that if we, heavens forbid, have another pandemic or another episode where our workforce is really stressed, that they feel confident and capable to do their jobs and they stay in their positions, because we don't want to lose folks for reasons unknown, for reasons that we could maybe have control over. And again, so the middle column, 51% of the people have been in their organization for less than 5 years. So, you know, we obviously saw transition during COVID. Some folks left their positions. Some folks stayed in their position or stayed in their organizations, but maybe moved into new positions. But overall, I think what these numbers reflect is that we do have a lot of our workforce who are in a position that they have knowledge and skills. They've been there for more than 5 years. They can act as mentors and support our newer, younger workers. The other thing that was really encouraging, we asked quite a few questions about education and desire to increase the education, but our workforce is pretty well educated. So we have, I have to look at my numbers, but I want to say we have, sorry, 36 and 26. We've got, I think it's over 55% of our workforce have a bachelor's degree or higher. And a lot of those degrees are either, and master's degree are in either public health or something that relates to public health, whether that's sciences and similar degrees, mathematics. So again, our workforce is very well educated. And I think the other area of opportunity that we want to ensure is that the folks that either are at the high school or equivalent or higher, or those with associate degrees, are provided opportunities to expand their credentials and maybe link into a bachelor's degree if that is something that they're interested in. So really trying to ensure that our entry-level workers are given the tools and the education and the credentials they need to do their jobs well. So we did also ask about credentials, and over half of our workforce, half of the respondents have nearly half of the respondents have some sort of a credential or a licensure. So to be exact, 203 out of the 448 respondents had a certificate or a licensure. So, and a quarter of those were the nurses. A quarter I identified as other, and this included teachers, fitness and health, informatics, physical therapy, management. So it really came from a wide variety. So again, I think in order to ensure that we have a workforce that has skills, that have confidence, if folks are interested in getting these licensures and credentials, that we provide avenues for them to do that. So that is an area of opportunity that we can expand on in the next couple of years. We did ask a series of questions about interest in pursuing degrees and certificates. And again, the results were very reassuring. 42 of the 448 responses, so about almost 10%, are currently pursuing degrees right now. And those were certificates in public health, masters in public health. There were several bachelors, there were a few MSWs. So again, we've got about 10% of the folks that are currently pursuing degrees right now, but 127 people out of the 448 are interested in pursuing degrees. So again, I think this is an area of opportunity to ensure that we find ways to support these people in their desire to pursue these degrees in education and credentials, because that equals a robust, educated workforce. And I guess my feeling is if people are interested in doing it, let's provide the ways, let's help them find those ways to do that. Okay, so finally, in this section, we did ask a series of questions about considering leaving their positions. So the question read, are you considering leaving your position in the next 2 years? And then it was either yes or no. And if they answered yes, then we dug in further and we asked, well, why? What's your reason for leaving? And so as you can see, about 24% of the yes respondents. So I will, I want to, let's see here, I don't have my exact numbers, but I want to say it was around 125 people answered yes. And then of those, 24% are planning on retiring. This actually fits nationally with the national statistics out there. PHWinds estimates about 1/3 of the workforce is reporting leaving their positions in the next 2 years. What I found interesting in our responses was of those the 32% that answered yes, half of them are interested in taking a position elsewhere. And we even broke this down even further. So it was one of 4 responses. They're going to they're going to find a different job, but within public health, at the government position. They're going to find a different job in public health in the nonprofit sector, or they're going to leave public health altogether. And of those 51%, about 37% are actually going to stay in public health. They're just looking for a different organization or a different work site. So even though 30% sounds pretty large, to me, it was not as discouraging, because a lot of those people are actually going to stay in public health. They just want to find something different. And the 24% that are going to retire, we know that people are going to retire. That's expected, especially as the boomers start getting older. And that's all part of succession planning. We need to ensure that we're providing trainings on succession planning, supporting people in the succession planning. And really that's a predictable and an area that we have some knowledge and control over. We know how to provide those that information. And then the other thing, of course, is that people want to go back and pursue their education. And so a lot of times when you pursue your education, you can't work full time. So I know it sounds discouraging, but overall, I felt like it wasn't as discouraging as it could have been. Okay, so in summary, our demographics, we fit pretty closely with the national numbers. We're mostly identify as white women, and we have quite a bit of our workforce that is newer and younger, yeah, under the age of 40. We have a highly educated workforce, and we also know that we need to plan for the future and ensure that we've got succession planning and opportunities for mentoring for new workforce as we expect transitions to happen. So with that, I believe we are
almost right on time.
Almost right on time, number 1, and I think it's time for our break. Okay, so welcome back, everyone, for part 2 of the workforce assessment discussion. And we're going to start this with a poll. And what I want to know is, on a scale of 1 to 5, how familiar are you with the public health core competencies? 1 is never heard of them. 2 is heard of them, but don't really use them at all. 3, neutral. 4, I'm pretty familiar. And 5 is I am an expert and I could teach them. So we'll give folks a second to fill it in. Looks like we've got a mixed bag here already, which is great. And these are the core competencies that are put out by the Council on Linkages. And I'll talk a little bit about it, but more about it. But they are our public health competencies that really drive how confident people are in their ability to deliver the 10 essential services and our foundational public health services. So we've got about a 50% participation. I think we'll share those results. And this is really interesting. We've got 25% of you have never heard of them. 25% rate yourself as a 2, a 3, which is neutral, and 1 of you is going to take my seat and teach these. So, and I didn't answer. Maybe Celine, maybe you answered, but it's exciting that somebody out there is a 5. So the core competencies are, like I said, they are put out by the Council on Linkages between academia and public health practice. They recently were revised in October of 2021. So the subdomain, the domains and the subdomains that we used for our assessment were the most up to date. They had changed a little bit from the ones that were used in the 2020 assessment. But these more closely reflect the changing times. And I think one of the biggest changes was domain 4, health equity. So we'll talk a little bit more about that. But there are 8 domains, and we're going to go through each of the domains, and within each domain are subdomains, and these really get into the nitty-gritties of these skills and knowledge that it takes to, again, deliver our 10 essentials and our foundational services. So we also asked a breakdown by tiers, and the Council on Linkages break it down into 3 tiers. Tier 1 is going to be our frontline positions, and about 56% of the respondents identified as a tier 1. Tier 2 are going to be supervisory and management positions. And about 25% of the respondents identified as a tier 2, and only about 17 people, less than 1%, identified as an executive or senior management, and 68 respondents chose not to participate in the question. So that's about 15% of the respondents. So an interesting mix. There is no set criteria or set matrix that they would expect you to see. But obviously the majority of the folks that are doing the groundwork and the day-to-day work are going to be in that tier 1 category. So the way when we broke it down, the respondents were asked to identify themselves on a scale of 0 to 3. So 0 would be you are unsure or you are unable to perform the subdomain at all. Number 1 would say you are a beginner. Number 2 would you would self-identify as proficient in that area. And number 3 is you'd identify as an expert and even be able to teach it. So as we go through the next few slides, there are numbers on these results. And basically what we did was we averaged all of the responses based on this 0 to 3. And then that is how we came up with the number that allowed us to rank these responses. So, for example, domain 1 is data analytics and assessment skills. And the other thing we did, because like many of you, 50% of you had either not ever heard of the core competencies or rated yourself as a 2 or even a 3, meaning you're not really, it's still a bit of a foreign area for you. What we spent a lot of time on before in the development of this assessment was putting together these competency statements, hoping that it might help folks really understand what it is that we're asking of this domain. So, for example, for data analytics, these would be including understandings on issues like homelessness, food security, and access to healthcare, and how that affects your community. It would include things like accessing data, collecting data, analyzing data from different sources like dashboards, monitoring, and community health assessments. And what we found was that in the subdomains, that many of the respondents feel very comfortable describing the factors that affect the health of their community. And that can be seen by this number 1.79, which ranked the highest of the subdomains within this domain 1, data analytics and assessment skills. And again, going back to that 0 to 3, 0 would be completely unsure, 3 would be an expert. So the majority of the respondents, the average, I said, I'm in that proficient range, a little less than proficient in this category of this subdomain of describing the factors that affect the health of the community. People also feel pretty comfortable using data, information, and knowledge to improve public health. And they also feel pretty comfortable accessing existing data. Where we need to focus is on providing skills and trainings on helping folks learn how to manage data, analyzing data, and assessing the community health status. Because as the numbers get smaller, that correlates with a lower proficiency or a lower skill, knowledge, confidence in those subdomains. And I will say that all of these subdomains came directly from the core competencies. We didn't make any of these up. These are all pre-listed, and these are very consistently asked across different assessments throughout the country. So for example, PHWinds in their on their dashboard, they ask these same subdomains. So the second domain is called policy development and program planning skills. And in that competency statement, that we developed, these would include skills that include accessing, understanding, and implementing policies, programs, and services within your organization, outside your organization, or in collaboration with others. So these would be things related to performance management, quality improvement, organizational strategic planning, and also your community health improvement planning. So like the CHIP. Again, ranking these from top to bottom, respondents feel comfortable in implementing policies, program, and services. And that is very reassuring in that though that's the bulk of the work that we do in public health is we implement programs, we implement services. The other second down, number 2, is in improving the policies, programs, and services. Again, very reassuring that the workforce feels confident to improve their policies, programs, and services. So areas that we could use some improvement, areas that we can really focus on for our trainings and for mentoring is in influencing the policies, programs, and services. And it's not surprising because influencing policy is a very challenging ask. And one thing I would say that we have to our advantage here in Montana now is that we've got some new organizations, including Confluence, which is it's the Montana Public Health Association, the Montana Environmental Health Association, and AMPHO, the Association of Public Health Officers, that have now combined to create Confluence. And this, we can leverage organizations like Confluence, like the Montana Public Health Institute, to mentor people in these areas where they recognize low confidence or low skills, to be able to raise those numbers, raise that confidence and that skill up a little bit. I would also say engaging in the community health improvement planning, and many communities out there right now are beginning to do their CHAWs and their CHIPs. And so recognizing that people need help with that. They don't feel totally confident and capable in their ability to engage in their CHIP and their CHAW. And so again, you know, leveraging these organizations and the state to help our communities and our health department leaders, this, you know, the numbers are telling us that this is where we need to put our energies. So that's domain 2. Domain 3 is communication skills, and these skills obviously make up a huge part of what we do in public health. So this would be developing and disseminating public health data, information into internal and external partners, assessing the communication preference of your target audience, and developing those messages, and also communicating information to influence behavior and improve the health of the community. So again, if we look at the results of this, the majority of the respondents rated themselves quite high in communicating with internal and external audiences. And I want to bring in a little nuance with our numbers, because going back to our 0 to 3, 0 being completely unsure, not confident at all, 3 being very confident, an expert, this subdomain ranked very high, almost a 2. So everybody feels pretty proficient at communicating with internal and external audiences. Versus, and I'm gonna go back a slide, because if we look at, oops, sorry, I went ahead a slide. I'm gonna go back 2 slides. If you look at our numbers for the domain 2, even the highest ranking subdomain, 1.69, is still quite a bit lower than our communication subdomain at 1.98. So again, it's all, there's a lot of nuances that we can glean from this data if we put some effort into it. It can be a little overwhelming though, I know, for a lot of people. So again, we need to continue to focus on providing trainings and building skills to communicate, because we know that public health has been criticized for its communication, the way we communicate sometimes. It was a big challenge during COVID. So I don't think I think we need to make sure that we still provide trainings and opportunities for people to improve their communication skills, because as we all know, as professionals, we're always working to improve our communication skills. The 4th domain is the health equity skills, and interestingly, this one in the previous iteration of the core competencies fell under cultural competency, but they've revamped it to health equity, which I think nicely aligns with a lot of the language out there. And we know that the 10 Essentials is based around health equity. So I think the transition and the language is nicely evolving in these core competencies. But again, as we, with that competency statement, these skills include applying principles of ethics, diversity, equity, inclusion, justice into our programs and services and policies. It also includes collaborating with community and partner organizations to identify and reduce systemic and structural barriers that perpetuate health inequities. And you can see from the results of these subdomains, there is a wide range of confidence. So respondents were quite confident in their ability to recognize diversity of individuals and populations. But when it came to contributing to achieving and sustaining a diverse, inclusive, and competent workforce, respondents don't have a lot of confidence in that area. And again, we can recognize this. We need to make sure that we're providing trainings that support building skills in this area, and ensuring that especially leaders that are tasked with these kinds of initiatives, that they feel comfortable and confident to be able to raise their level of skill in this area. Another area that we can really focus on is implementing policies, programs, and services to achieve health equity. I will say that overall, folks understand health equity and they're engaging in self-reflection, but in terms of actually moving from individual to system-wide or organization-wide, that's a lot harder. And it's an area that we really can focus on moving forward. The fifth domain is community partnership, and this reflects just being able to describe the current conditions, systems, and policies affecting the health in your community, resilience that may be contributing to the health disparities and inequities. It also includes skills to build and maintain relationships that improve community health and resilience, and ensuring that power and ownership are shared with community members and others. So again, this really is about that community piece. And again, respondents feel quite comfortable collaborating with their community members. And that's wonderful, because that is when you get buy-in from community, your ability to implement and to provide those services is a huge success, can be much easier. If you're not collaborating with your community, or there's tension in the community, it is much harder to gain trust and to implement policies and programs. Areas that we can improve is to be able to describe the conditions, systems, and policies that affect the community, and also sharing power and ownership. I think that's a challenging one for to really get your brain around sometimes. So again, these are areas, potential trainings, opportunities for mentoring, and ensuring that we're providing skills and ability for people to improve their confidence in those subdomains. The domain 6 are the public health skills sciences. Again, maybe for the sake of time, I'm going to not read this competency statement, but what I will say overall is that the ranking was fairly lower in overall. So if you look at the number 1.67 compared to something like communication that ranked almost close to 2, going back to that 0 to 3, public health sciences skills is an area that we need to ensure that folks are getting this in their curriculums, in whether it's an undergraduate program, a graduate program, and certificate programs. And we also need to just ensure that the language is being used consistently across. So we have some ability to provide trainings in this area to improve skills. Domain 7, management and finance, is a very thorough domain. There's 13 subdomains. And I can imagine by this point in the assessment, we were losing people in their ability or because there's a lot of this, each question, obviously people had to answer how they ranked themselves. So again, for the sake of time, I think what I would recognize is that people feel very comfortable in their ability to think critically in decision-making. And this is really important because this is a very core fundamental skill. Critical thinking is something that it actually is very hard to teach sometimes, and it comes with experience. But the fact that folks felt like they are proficient in this area is very positive, and it's a very optimistic picture. They also feel confident in their ability to participate in professional development. The area that we really need to ensure that we're providing resources and education in is that securing human resources, securing financial resources, managing financial resources, and managing human resources, as well as contingency planning. All of these subdomains that ranked below, I would say, a 1.5, that essentially is saying that people are very unsure in their abilities to do these skills. So we really have our work cut out for us in this management and finance area. And I'll talk a little bit more about it when we get into our motivations to attend trainings. Our final subdomain or domain is domain 8, leadership and systems thinking. Again, we've got some areas of improvement that we need to work on, and that would particularly be engaging politicians, policymakers, and the public to support public health infrastructure. Again, people rank themselves very low, unsure to beginner in this area, a 1.07. So, but this again is a very hard area to feel comfortable and skilled at. And again, I would fall to our organizations like the Institute, Montana Public Health Institute, like Confluence, to act as role models and leaders to help bring people more confident and more skilled in this area. What is reassuring is that people feel confident that they can advocate for public health within their groups and within their communities. And that, again, they also feel confident in their ability to engage in self-reflection. So these are harder skills sometimes to teach at that individual level. So reassuring that people are ranking themselves higher in that area. Okay, so once we got all those subdomains, we then ranked them by the 8 domains. So just from highest to lowest. So the number 1 most confident, most knowledgeable was in communications. And that's wonderful because, again, we do a lot of communications in public health. The second highest ranking domain was the community partnership. Again, this is fantastic. People feel comfortable working with their partner, with the partners in their community. And the third highest domain was health equity. The areas that we really need to focus on is that domain 8, leadership and systems thinking, domain 7, the management and finance, and then domain 1, the data analytics and assessment. So moving forward, we need to ensure that we are offering trainings and that there are opportunities in those 3 lower domains. And what I would say is that based on the results of the 2020 workforce assessment, management and finance and data analytics and assessment were also ranked low in proficiency. So there's a consistent theme running here. And I think we just need to continue offering trainings in this area. So another question we asked was motivation to attend the trainings. And what is very encouraging is that the number 1 motivating, the area that they are the most motivated to attend is the area that they ranked the lowest, domain 8. And I think on the next slide, I show these together. So domain 8, they ranked themselves, respondents want to attend trainings in this, and they also ranked the lowest in their proficiency and their confidence. So that's really reassuring. And I will say that respondents could choose up to 2 answers for this. So they were allowed to pick their top 2. And so this graphic shows the crosswalk between their proficiency and then the motivation to attend. So again, number 8, you can see our systems thinking, it was the lowest proficiency, but the number 1 for motivation to attend, which is really reassuring. The second highest was the policy and development and program planning. They ranked number 2 in high motivation. It is fairly high in proficiency. But again, the third highest ranking was the data analytics, number 1, and it also ranked lower in proficiency. So we've got a nice picture of how, moving forward, what kind of trainings in what areas. I will say that for the management and finance, folks ranked low in proficiency, but also low in motivation. Number 7 So we have to find a way to sort of trickle management and finance into our trainings, because it might be hard to get folks to show up for a management and finance training. So our thoughts are, what happens if we just incorporated a little bit of management and finance into every training that we do, so that we are kind of sneaking it in there a little bit. The one other area that we did ask is some of the other frameworks that we have talked a little bit about over the course of this discussion here today, and folks' skills and confidence in their knowledge of these different frameworks. And you can see that people are very confident in understanding the social determinants of health, health equity, and the 10 essentials. Where we really need to help some exposure is in our Public Health 3.0, which is one of the older frameworks, and also environmental justice, and a little bit of the FAB, the credentialing or pathways recognition. So again, this is some interesting results that can glean information for trainings moving forward. Okay, so in summary on the core competencies, we found that we need the areas that ranked lowest in proficiency are those management and finance skills, the leadership and systems thinking, and the data analytics and assessment. But the motivation to attend is high in the leadership and systems thinking and data analytics and assessment, which is wonderful, and also policy development and program planning, which I think is an area that always can use some refreshing, especially as new tools come out. So again, offering trainings in that area is a win-win for everybody. Do we have a follow-up questionnaire for this one? I can't remember.
We did, and this one's a thought question. It's how would you design trainings that address core competencies and enhance daily skills? And this one's kind of a short answer one, so I think we should just leave it open while I kind of keep going with the next section so that people can have a chance to.
I think that's a great idea. And I actually think maybe people could put it in the chat too.
Mm-hmm.
Either one. Ideas come along. Either one. Yeah, the quiz or the chat. So with that, I think I'm going to hand it back over to Celine to talk about the professional development and trainings.
Perfect. All right. So hello again. You guys have seen Lee for a little bit, so I get to bring us down the home stretch. In this section, we're going to address the findings related to professional development and training that came out of the workforce assessment survey. Hopefully this section will be about 15 or 20 minutes, and then we've got a summary and some time for questions and discussions at the end. So let's get started here with the next slide. Thanks, Lee. So respondents in this section were asked to identify whether they had attended any trainings in the last 2 years. And then if they answered yes, how many trainings total they attended. And in this case, trainings were defined as formal classes, conferences, webinars, self-paced learning modules, etc. And of the 255 respondents who answered yes, a huge number of them, 110, responded that they had attended more than 5 trainings in the last 2 years, which is really interesting. You know, there's a nice bell-shaped curve with those lower numbers of people having attended 1, 2, 3, 4, but that more than 5 category surprised me a little bit, in the sense that we do have a really educated workforce. But the opportunity is that we also have a really motivated public health workforce. And I think the opportunity with this lies in the ability to capture that momentum. So people are excited to learn, they're interested in furthering their education and having skills that they can apply to their daily work that they do. The next question that we asked, if you want to advance the slide, Lee, was what types of professional development trainings did you attend? So individuals that answered yes on that prior question were shunted to how many that you did, or which trainings you attended. Those that responded no just skipped to the next section of the survey. So that it's really this workforce assessment survey was a choose your own adventure type of survey. And the list of selected topics that we put in there was pretty broad. So we had, public health sciences, some equity, diversion, inclusion, behavioral health, but we also allowed individuals to free text the entry under the other category. So some of the training topics that we identified, as I mentioned, were public health sciences, the equity piece. There was also individuals responding healthy mothers, babies, and youth, financial planning, trauma-informed care, change management, emergency preparedness, project and program management. So it was really diverse, which I think is a great thing to learn, is what is our workforce interested in learning and applying. This has to do with that career development piece, and I think improves retention as well by asking individuals what their career goals are and finding out what kind of trainings they're interested in. We can really help retain those individuals and keep them in our workforce. You want to hop to the next slide? Whether it's personal or professional, something always, I think for all of us, gets in the way of attending trainings, professional development conferences, whatever it is. So we asked respondents to identify barriers that prevent them from attending trainings, using a select all scheme. So we didn't limit the number of choices that people could answer on this. And we also gave them the opportunity to free text after selecting the other category at the far right. So the data that I'm showing you here is just reflective of the raw numbers of responses in each category. So you notice the raw numbers don't add up to our 448 total individuals responding. So the top one here is unaware of trainings. The second, the cost and logistics, are pretty consistent with previous surveys that went out. The other category, the major theme was not enough time and needing to prioritize workload. So the opportunities here, what this tells us is that we as trainers and educators really need to improve communications, and whether that comes directly through supervisors, email, text, the workforce website, flyers, etc. We can do a better job of letting people know about trainings and opportunities to receive education. The second piece of that with improved communications is making sure that there's plenty of advance notice, so that if individuals do need to find coverage for their responsibilities, that we give them the time and advance notice to do that. And then the last one is identifying funding to subsidize workforce trainings. And this can come from the individual organization or the state or different grant programs. So those are some of the opportunities that we took away from this area. So the next slide is really the reverse of that, where respondents were asked if incentives were encouraged them to attend these trainings and which ones might work best for them. They were again provided the opportunity to free text after selecting the other category. And the data is reflective of raw number of responses. Within the other category, which is listed up at the top, the major theme was continuing ed credit for attendance, swag, so stickers, water bottles, etc. Individuals also noticed that they might like to see pay or advancement increases with trainings, as well as designated team training time. So it was really worth noting that 76, 3/4 of the workforce said that, yeah, incentives would encourage them to attend. And then of the top responses, the largest bars down at the bottom here, use of work hours for training, I think is really important. People don't want to give up their lunches, their evenings, or their weekends to do these trainings because it is for the workforce. And then having travel expenses paid for, so it's not coming out of your pocket, and the prize drawings that, you know, swag, Amazon gift cards, etc., really encourages people to attend these trainings. So the opportunity there is to encourage our public health organizations and supervisors to prioritize development and training as part of the normal workday. So in those work hours, to incorporate recognition perhaps into performance reviews. And then of course, identifying funding to subsidize the trainings as well as small pots of money for prize drawings and swags. The next slide is how do people want to learn? So what's the preferred type of learning platform? In this question, respondents were asked to identify their top 3. So again, they were able to choose 3, and the data is the raw numbers. They were also provided the opportunity to free text in the other category. We only got 3 responses there, so we didn't really make any meaningful conclusions out of that. But as you can see from the graph, the in-person hands-on training is really the preferred type of learning platform, which is a little ironic to be presenting this training to you all via Zoom, but that's all right. We can take this data and information and work to make things better for the future. The blended and online self-paced were the number 2 and number 3. So being able to potentially flip the classroom and do some work at home, some readings, some online trainings or modules, and then meet in person to continue that. The one that people did not like was lectures and then observation and feedback. So no one really wanted a mentor or colleague to come and watch and see what they do and provide them feedback that way. So the opportunity for us is to prioritize the in-person workforce development and training, and then also try to incorporate more hybrid self-paced trainings into that as well. With regards to the preferred locations for in-person training, perhaps there's no big surprise here with what our data showed. So the largest number of respondents listed Helena as where they would prefer to have their in-person training with some of the larger cities across the board here. So they were also provided the opportunity to free text in the other category. So our raw numbers of responses is where it's here. There wasn't any consensus within the other category. There was no one city or region that popped up in there. I think what we need to do when we are putting together the in-person workshop development and training is to make sure that we prioritize accessible in-person trainings that are spread across the state. So, you know, perhaps we try to do it more regionally as opposed to large cities to make sure that we're not ignoring some of those smaller and tribal public health employees by asking them to always travel to Helena, for example. The lessons learned, if you want to think of it that way, is in the communication as well. So respondents were asked to identify their top 3 preferred communication tools. They again had the opportunity to free text something other if we didn't provide an option for them to choose. So the number 1 method of being notified of upcoming trainings was email. One of the large challenges with that is actually getting a hold of email lists to directly email individuals and make sure that they know about these trainings. So we're brainstorming and thinking about ways to have a comprehensive email list for that. Within the other category on the end, the major theme was direct promotion by supervisors at staff meetings or via an email from your supervisor. So, you know, one of the ways that we have thought about this is maybe instead of trying to get the email of every single public health employee, that we get those supervisors so that we can get the message disseminated via the supervisors directly to staff in that method. The next two highest were the workforce development website and then a physical flyer posted at the work site. Social media and connected communities, people didn't seem very enthusiastic about. So we've got some opportunities here, which include encouraging our public health organization and supervisors executive level to prioritize the training as part of the workday, and to, from our side, maintain an up-to-date database of those leads and supervisor emails. And then also making sure that we maintain and promote an accessible catch-all website for those professional development and trainings in public health. And then our next slide is a response to how likely individuals were to attend future training sessions in these different topics. So these are not broken out by the 8 domains, but you can see that some of them are very similar. So the top response was leadership and communications. That's really similar to the domains that Lee mentioned. So our opportunity here is to really offer trainings developed and tailored to the audience. So with that, I mean that our executives and supervisors, managers might need a little bit different training in leadership and systems thinking than our non-supervisory public health worker. I think Lee also mentioned the fact that we want to look at combining topic areas. So even though leadership is something that people are really interested in combining trainings on, and budget and financing is not, we can sneakily put the two of those together and make sure that people are getting budget and finance within leadership and systems thinking training. This next slide, I think Lee went over. This was just reiterating the fact that our public health workforce is most interested at this point in receiving training in the leadership and systems thinking skills. Some of those that fell to the bottom, the health equity and communication skills here, I think those ranked lower because of the fact that trainings have been offered in those areas recently. So that's part of why our workforce is feeling really good about health equity and communication skills. You see the management and finance still ranks pretty low on the list. So again, we can tailor our trainings to that. The last 2 slides that I have to talk to you about today are related to employee wellness. So our respondents were asked whether they had participated in wellness trainings in the last 2 years. And then if they answered yes, which organization offered the training? And then in the next slide, we asked them what type of training that was. So we had 229 individuals who answered yes, that they had attended a wellness training. And then the data presented here is our raw responses as to who provided that training: the insurance provider, the workplace, the Montana Public Health Training Institute, or the other. Within the other category, this was our free text, and the major theme there was just a self-directed interest. So individuals were taking either mental or physical wellness classes through various means. So the opportunity here is to encourage our public health organizations and supervisors to prioritize wellness, the physical and mental health as a part of the normal workday. And then I think from a training perspective is being able to maintain and promote an accessible bank of wellness shorts. So 20 to 30-minute experiences, walking meetings, things like that, that can really help support our workforce. The last slide that I have to present to you all is what types of wellness programs are appealing most. And respondents were asked and provided the opportunity to free text. Most of these responses revolved around work-life balance and increasing importance on self-care. The number one and number two were physical health and mental health. And then employees were really interested in nutrition and alternative medicine as well. So I think that that's a great opportunity for us to, again, prioritize this as a normal part of the workday. And then also potentially partnering with outside organizations to offer wellness experiences in nutrition or alternative medicine. So let's see. Looks like we're going to share the results of that other survey and then launch the one from this one.
Yep, I was going to say, so I just stopped this one because I don't think you guys can see what was written. So one person answered, and their answer was, I would include management and finance into team building training, or maybe linking services to management and finance.
Oh, okay.
That's great. Super.
All right. So our quickie summary here on this one. In terms of the barriers, and these I think are going to resonate and make sense to everyone in the audience, is the biggest barrier is not knowing about the trainings. So we can do a better job and through partnership, make sure that we really get that out there, get notification out sooner and to more individuals. Costs and logistics, we're working on that. So we can try to address those as well. We learned that individuals like in-person learning, or if they can't have that, the hybrid and or self-paced online learning is key. The desired trainings, just to reiterate what Lee mentioned, is in leadership, communication, and the data analytics were our top three. Budget and finance is something that we really need to sneak in there and bring up the skill level at. Incentives would motivate a lot of the workforce to attend training. The use of working hours, so not taking up lunches, weekends, or evenings is key. Paying for travel expenses and then either prize drawings or swag is very important. Notification, we learned how employees want to be notified. It's emails, websites, and then flyers at the work site. And then as far as the wellness goes, the work-life balance, I think, is very key. So the physical and mental health, alternative medicine, and nutrition are very much of interest to our workforce in general. So I think we're starting to run up on the end of time. So I'm going to skip the question for this one. And then, I don't know, Lee, do you want to take on or do together the overall findings here?
Yeah, I can review the sort of the summary. And I will say Emily has posted in the chat an infographic executive summary that we created for that was disseminated at the Confluence Public Health Conference in April in Billings, which reinforces, I think, what we learned here today is that people do want to have these education opportunities and training or in person. And this presentation was given at Confluence. Very similar presentation was given at Confluence. So for any of you who were at that conference, we did actually do it in person initially. And here we are now doing it on Zoom. But key findings, we've got a younger workforce, but we do have people that have been in public health for over 5 years. So we really need to tap into those people and their skills and their knowledge to support our newer, younger workforce. We also have a highly educated workforce. 65% of the respondents have a bachelor's degree or higher. We've got people that are motivated to develop their education or pursue education and get certificates, which is very exciting, and we need to find ways to support those people in those desires. We have a lot of people that attended trainings, like Celine said. 43% attended more than 5 trainings. People were highly motivated to attend these trainings. So that's really great. The other thing that we found was that, like Celine mentioned, that some of the domains that identified as low, things like public health sciences and health equity, cultural competency, there were a lot of trainings on those in the last few years. And so conversely, the skills improved and people recognize they don't need those trainings as much. The other thing that was really reassuring is that things like leadership and data analysis, people responded that they have a high motivation to attend trainings, and they also identified themselves with low skills. So there's a nice match going on there. The other things we found was that people want to gather in person. That, like Celine said, there's the biggest reason for not attending trainings was unawareness. So we can fix that. The wellness programs, getting back to the succession planning, we've got about 30% of the folks that did report wanting to leave, but many of them are just switching jobs. They're not necessarily leaving the workforce altogether, but we need to make sure that we don't miss opportunities to support people in their career development, in their professional development, and ensuring that those folks are getting the opportunities that they want so that they do stay in their positions and grow in those positions. And the other thing I would just say is that this assessment, like I said earlier, I feel very lucky to have been able to work from the platform that was created and the framework that was created from the 2019-2020 assessment. And really, this is providing us with some immense amount of data and information to build a robust public health workforce to support our future initiatives and programs needed across the state for a healthy state. So with that, I think we do have a couple of follow-up polls, I think, perhaps. We've got about 5 minutes. So this is a little bit of a quiz, I think. And the first one is a short answer. What is a workforce assessment? And you can just short answer that in. The second question is, describe why you would use a workforce assessment in your work setting. And the third question, what do you see as the benefit or drawbacks of a workforce assessment in your organization? And if your organization, let's let folks answer those questions. And while you're filling those responses in, if you have any other specific questions for Celine or myself, please don't hesitate to either put it in the chat or raise your hand here, because we're wondering how folks see this workforce assessment, or how you would use it in your work setting, or if you could see creating your own workforce assessment for your specific organization, if you see that happening moving forward. I guess one thing we could do is make it a little simpler so they could be answered yes and no. What do you think, Celine?
Yeah, I think that's great. Probably the yes or no would be, have you designed a workforce assessment, or, are you using a workforce assessment in your own organization?
I guess maybe we could, maybe for question one is, have you used a workforce assessment in your setting, in your organization? And number two, do you plan on using one? Those are the two questions I guess I'd be, and you can even just write it in the chat or, shout it out. You can unmute yourself and shout it out. I get that these are, okay. And Emily, you might need to read these out because I can't see them.
Yes, I can read them out, but only after we end the poll. So I'll give it
Oh,
a
okay.
minute.
All right. Okay.
And again, people can use the chat too. The quiz or the poll just makes it anonymous.
Yeah.
Here,
But
I'll
one thing I'll just be said, I just do want to say here before we wrap this all up is, number one, I really want to thank everybody out there that completed the workforce assessment, because we can't do these kind of things without you. The other thing is that if anybody is interested in any of the work that we've done, please don't hesitate to reach out to myself or Celine or Emily at the training center, because these assessments are only as good as the participants that engage in it. And I think, and also moving forward is, do you see your organization benefiting from an assessment like this? Because there are many different ways of doing these assessments, especially in your own. I do know some health departments have chosen to do their own their own workforce assessment, because they, it stays within their organization. So moving forward, go ahead, Emily.
I was gonna say, just that before we end, we did get someone who rocked the quiz questions. For what is a workforce assessment, it's an overview, a deeper dive into the demographics, level of education, career statistics of a group of people. And then describe why you would use a workforce assessment, gain knowledge about about what people know, how advanced they are in their careers, level of knowledge of concepts related to their work. And then what do you see as benefits or drawbacks? Benefits: get a current snapshot of staff education and knowledge. Drawbacks: need to constantly update with staff turnover.
Yeah, wow. Thank you for that, for whoever put that up there. That's awesome. And gold star for the day. And I think you're absolutely right in that this is a snapshot and things are constantly changing. And that is why, in order to really get a deep understanding of where your workforce is at, where your organization is at, we need to constantly be checking in, and maybe doing these types of assessments on a rolling basis. And that's what is so reassuring. This one was done in 2019, 2020. Here we are at 2022, 23. So continuing these efforts so that you can keep up with the changing times, because we know that times are changing for workforce these days. We also thank you, Morgan, for joining. I think given the time, Emily's put the evaluation survey up in the chat. So for those of you, thank you for showing up today and sticking with us for the 2 hours. We really appreciated having you here. Like I said, if any of you have questions about the assessment, please don't hesitate to reach out to myself, Celine, or Emily. And Emily, can they get this survey once we disconnect, or will it?
I will email it out along with the recording.
Yeah. So I think for the sake of time, everybody, thanks so much for showing up today, and have a lovely day. And yeah, thanks, Emily and Celine, for all your hard work on this.